Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and with me again is Mr. David Pryor, who is what is your title at Planet DDS, my friend?
Director of Imaging for Haptics.
For Haptics. And thanks for being here, Dave.
Thank you.
Once again,
Thanks for having me.
Making another guest appearance
Sure.
of the Magic Ingredients here at the Patient First Podcast. What we were talking about today was the implementation of technology, right? Because you're dealing with a lot of large groups who are bringing on your imaging services.
Yeah.
And one of the things that we both see is that there's a big difference between having a good idea and having this technology that's great and actually getting it successfully implemented in your practice or your practices.
Yes, the rollout is a challenge.
It's a challenge. Yeah. So what have you seen that has worked for people in implementing new technology across their organizations?
I think it's early on having a clinical. I always look at adding a new technology to any sort of dental practices. It starts with a clinical decision first. And I think bringing in the clinical team and having them have a voice early on in the decision-making process is beyond critical.
So are you saying that having the clinical team available to have the perspective on why this is being done, is that particularly important, or how it to get implemented, or both?
I think both, but one of the things, I think for a lot of technology, people talk in the ether and they talk about how this technology is going to help your business do X, Y, or Z. And when it comes down to the clinical use of the product, that's where the rubber meets the road. And if you can't demonstrate how that's going to improve patient care or speed things up in the clinical environment, I really struggle with how are you going to get adoption in that clinical environment from that team? And if you can't get that adoption, then you're spinning your wheels.
Yeah. One of the things that I've always struggled with since being involved in the DSO space, since selling my practice as a DSO and being part of the team, is there's some things that just make sense, right?
Yeah.
And I feel like in groups sometimes that which just makes sense gets overcomplicated.
100%.
And so there can be something that just makes so much sense in the world. And then the perspective, the filter by which decisions get made gets completely messed up. So things that should not be a big deal to implement get delayed or put off or don't see that big of a deal. And then other things that yeah, maybe, but why gets implemented because there's this case study, or you can show a case of, for a patient, for 10% of patients, there might be an extra $10. And that doesn't really move the needle at all. Does it? Do you agree with that?
I do. I look back at the example for you of going to digital x-rays back, 25 years ago?
Yeah. I only got out of dental school 25 years ago, so probably 22 years ago.
Yeah,
Yeah.
so a long time. And back
Mhm.
then, was bleeding edge, and you were dead set on it, and it was really expensive. But the payoff came over a pretty short period of time.
Yeah, I would say it wasn't expensive. It was a very easy decision because I looked at it and I was like, better than in every way. And even 22 years ago, less expensive than film.
Yeah.
Period. I commonly say if you have film x-rays, you have two options. You can either get digital x-rays, or I'd recommend you hang up your handpiece, because I don't see a reason to have film x-rays in the year 2024. Now, there may very well be some edge case, Larry, if you're out in some area where there's no power, right? Then yes, maybe, but very rare exceptions. I can't imagine why, if for somebody that has a dental practice in the United States of America,
Yeah.
that they have patients coming in regularly and they're taking radiographs, why they would use film. I don't know. If somebody knows, please comment, let me know,
Yeah.
because I say this a lot. I'm like, if you're still using film, hang up your handpiece.
And you've been saying that forever. Like that.
Oh, at least a decade. Yeah.
Right. And so then I look at other technologies. So that for, I think most people, there'll be in agreement with you, where
Mhm.
you look at digital x-rays as obviously that's the route to go, and it's just what form does that take. But when you start talking about newer technologies, like the things that you're doing, I work in imaging where it's moving people into the cloud and being able to have a conversation around that and how that's going to benefit whether it's an individual practice or DSO, and having those conversations. There's times in the clinical environment that it becomes very blurry when talking about more advanced technology. And in the clinical environment, they struggle with so much is changing so quickly right now that do I have to adopt every technology and which ones are the ones that make the most sense? And I think a lot of times they struggle with being overwhelmed with too many choices and too many decisions to make on which technologies to adopt at what time.
Yeah, I totally agree. And I think that it's not, I think people overcomplicate it, right?
Yeah.
I like to say, and I have this in one of my presentations where it's if you're an alien from outer space and you come down to planet Earth and you do everything that a human does in the year 2024,
Yeah.
you buy groceries, you go get coffee, you go to the gas station or go to charge up your electric car, whatever a human does, but you don't go to a dental practice. And then you get told, here's what a dental practice does. And they describe, and you think, okay, how would that experience be in the year 2024? That's where you should start.
Yeah.
Should you be able to pay your bill on your phone? Oh, yes, you should.
Yeah.
Right. Or in the case of like you, like, should you be able to view an x ray wherever? Yeah. There's some things that are obvious, that so obvious that when you hear of them, you go, why doesn't everybody do that?
Right.
That's the place to start. And the good news is that these are lower cost, easier to implement things than the big things like 3D printing or CAD CAM or doing some type of whatever, some massive change thing. Being able to implement text to pay, this is not implementing something new. And
So
you can't look at you and the team shouldn't look at this as implementing something new. You should just be looking at this is what businesses do. We're getting caught up. And all of those,
yeah.
what should you implement? Absolutely everything. If it's expected by your patients, you're late.
Yeah,
Period.
that was true. I think you really hit the nail on the head where it's things get overly complicated, and really just getting down to the core of what is the benefit of this technology going to be for my particular practice is where to start. And like you said, if patients expect it, like when you're talking about a text to pay, or like when we go back in time and we look at Opera DDS, and when I first started selling Opera DDS with you, we were selling online forms, and I would talk to offices where they're like, "Oh, we'll never switch to online forms. Our doctors love paper." And I was like, because I come from a technology background, I couldn't believe my ears. I was like, "This is better in every conceivable way,"
Hmm.
and I'm at a loss for what you're telling me. And so I go back to I think your initial hypothesis is right. Like it just gets over complicated. This makes everything infinitely easier for you, and it like I can do an ROI discussion. Any sort of technology that we're promoting on a podcast like this is going to be something that is going to essentially 10x whatever you're doing. If you're here and you're presenting a technology, it's going to give you an ROI of 10x, whether that's time, whether that's money, whether that's the ability to improve the patient experience. Any of those different avenues that you're trying to accomplish, I think when we're talking when with what you talk about on this podcast where you're really getting into the very edge of the technologies that are available, that's those are easy discussions to have.
Yeah. And you're right. Do you have to implement every technology? Absolutely not. What if you were like, pull yourself out of dentistry? What if you had a restaurant that you like going to? And that restaurant did things like you had to go up and pay at the counter with an old school, and you had to write by check. Like, would you go to that restaurant?
Right.
I wouldn't. Some people would. And so you can not do this stuff, right? But guess what's going to happen? You will become that archaic dental practice. And by the way, what's the number one issue that people have with dental practice, practicing dentistry today?
I don't know. You tell me.
Staffing. It's
Oh,
getting
yeah,
team
yeah,
members. Who wants to work for the archaic practice?
yeah.
Nobody, not one person.
Right.
So if you love your paper forms and you don't want to do interoperability and you want to have a single login, you want to have multiple logins for everything and you want to have like film x-rays for having your assistants process those and then you complain about not being able to find team members, like that's the problem because your customer isn't just your patients, it's also your team.
I've got a friend that works in dental, and she's a hygienist,
Mhm.
and she's not happy at her current environment, and she's struggling. Should I leave or shouldn't I leave? I'm like, all that's going to happen is you're going to make more money and you're going to have a better experience at your job. So,
Not necessarily.
well,
Could be worse. She could make less.
but
We
then
don't
she
know.
can move again. Like,
Yeah, yeah,
I
no, it's
mean,
true. Today,
it's
that's true.
yeah. Right now for dentistry, man, it is a struggle in the employment
And
area.
by the way, the other thing is that these expected technologies
Yeah,
for people to implement, it's going to make everybody's job easier so they
yeah.
can actually, you can have less people to do the same tasks.
But I think to expand on that point, everybody's short on staff. So you need to implement these technologies because you can't get the hiring done that you need to get done.
Yeah, yeah. And then again, ironically, then you'll be more likely to be able to attract team members because they
Yeah.
want to work in an office where things are automated and easier to do and smoother and have those technologies. So, yeah. And so when it comes to implementing, what tips do you have for people about how, like, okay, maybe we haven't done online forms. And so we're going to find an online form provider but we don't know how to implement something. What tips do you have for
Well,
people?
I always go back to the start. If you include the people that are actually going to be using the product in the decision making process and get them excited about it, that's really what it comes down to is enthusiasm and how it's presented to that clinical staff. It's absolutely the biggest thing, and you've got to be hitting on one of those cylinders. More money, better patient experience, more time. One of those things has to be the trigger that makes you excited about the product.
When you say you, who are you saying you?
The the clinical staff.
Yeah.
So whoever it is, whether it's a doctor, whether it's a hygienist, assistant, front desk, whatever the case may be, some technology, whatever technology you're implementing is affecting at least one, if not all of those different areas.
Yeah. I always say with what's in it for me,
Yeah,
explaining it to the team member from their perspective,
yeah,
not yours,
yeah,
right? Same
yeah.
thing with patients, like talking about maybe you're doing paperless forms, saying how much easier it is for you as a dental practice isn't going to get it, cut it.
Right.
Now you can fill out your forms on your phone, auto populates everything that's in your phone, stuff like that. It's speaking about it from the other person's
Yeah,
perspective.
100%. You have to have that empathy, that understanding of what the problems are in their day. And if you're not speaking that language, and here's what I'm helping you solve, and here's how it's going to improve your life and your patient's life, and those around you. That's how you get that across the finish line, I think.
Yeah. And I also think having one person that's in charge of championing the cause, right? Having somebody identified that goes, okay, it is your job because you're enthusiastic about this to get everybody else enthusiastic about it and implement this. Otherwise, because if it's everybody's job, nothing gets done. It just kind of spins in place.
But I will say, in my experience in dental, like I'll talk a lot with people in technology. It's great. It's great to get the technology buy-in or the CFO or CEO, those different people buying in. But at the end of the day, that champion really has to be from the clinical side, in my experience in
Hmm.
dental. You can have the CEO coming down and saying, "We're all doing this," but if that CEO doesn't have that clinical background, which happens in DSOs, then you're going to have some resistance if you haven't gotten the clinical buy-in first.
Yeah. And flip side, I think sometimes you get the non-clinicians in a large group
Hmm.
that overcomplicate things that are just obvious home runs clinically,
Hmm.
right? So I think sometimes just listening to the clinicians, I think, is vitally important.
Yeah.
And there's more and more dental meetings that I go to where I'm the only dentist in the room. And what is obvious to clinicians can be very not obvious to non clinicians, too.
Yeah.
Yeah, I think we've talked about that before. I feel like right now we're at this point in time when what makes sense clinically is becoming more and more important because people who are aggregating practices can't just go out and buy the practices, lump them together, and resell them. They're looking to grow the individual practice. And when you're looking to grow an individual practice, it's a different thing. And it comes down to clinical efficiency, higher quality of care, meaning a better patient experience.
Yeah.
And those things, I think, sometimes are very difficult to quantify on a P&L, but very easy to see if you work in a dental practice.
Yeah. How do your patients like the practice? I mean, that's really what it comes down to, don't you think?
Yeah, and the team again,
Yeah. Yeah.
because that's when patients walk into practice. No, I've walked in a restaurant many times and been like, every fiber of my being just says leave. And then you walk in another restaurant and it's just like you've never been there before, but you walk in and you're just like, oh, I'm glad we're here.
Yeah.
And the same exact experience happens in your dental practice. I walk into my own dental practice and there's been experiences like I'm glad I'm here and experiences where I'm like, what the hell am I doing here? And it all has to do with how the team is experiencing care. But that's very difficult to put on a P&L
Yeah.
and say, ooh, we're going to get 10 new patients this month because people are going to be happy because they're not doing boring, laborious stuff that is just moronic to have a human being doing that we can pay $100 a month to have this automated platform do.
Yeah.
So, how much is that $100 a month costing your practice? Flip it around. How much is it costing you to not have your team being able to leverage this technology to make their lives easier?
Yeah.
And that is very difficult to put on a spreadsheet.
Yeah. Yeah. Like we talked about earlier, that 10x factor of the things that you discuss on your podcast where you're creating that 10x experience, it does that much to improve your practice. I think it makes it really important to listen to podcasts like yours in order to stay up with what is coming in dental. I For you, I think you see this as, because you're working in it every day, but a
Yeah, yeah.
lot of what you work in is very bleeding edge. And so for a lot of practices, it can get hard for them to wrap their head around it. When I talk about when I started working with you and selling online forums, it was people were like, oh, that really seems unnecessary. And now I think for most practices at this point, they're all bought in
Yeah, yeah, yeah.
on online forums. And now I'm working in cloud-based imaging, and I'm starting to get a lot of interest in cloud-based imaging, particularly around things like 3D and AI and those things within the practice. And it's really getting a ton of momentum. But even a year ago when I first started, there was not that much enthusiasm about cloud-based imaging.
Yeah.
And now it just grows and grows and grows.
Look, it makes sense. Imaging, let's call it the colorization of so patients can see what's going on in a radiograph or
Yeah.
team members through AI. What we're working to have a patient have their dental record so they can actually review it at home, which is federally mandated. Oftentimes people ask me, like, why hasn't somebody done this before? And that's the biggest litmus test. If when you're hearing about something, you go, "Oh my gosh, why hasn't this been done before?" Yeah, that's something you should implement because that's that alien from outer space coming to town. It's like, okay, if you could have a 2D X-ray or a 3D X-ray, all things being equal, which do you want?
The 3D
Oh
X-ray.
my
Yeah.
gosh, it's an obvious answer.
Yeah.
So don't overthink it. Just look and say, is this actually better? Oh my gosh, it is. Yes. Then it just the rest that's how I've grew my practices. And if it makes sense, guess what? it makes sense.
Right.
And I always, when people ask me, why haven't people thought of the fact that there's a my chart for my medical that my dental patients don't have any of the information at home.
Right.
Why doesn't it exist? And I say, well, I'm old enough to remember that it was in the 80s that I first saw suitcases with wheels on them.
Right.
Once you see a suitcase with wheels on it, you go, what the hell were people doing for the last 50, 100 years? The first caveman that put stuff in a sack should have put a wheel on there, right?
I just, on that point, I just bought a new backpack to go for traveling.
Yeah.
And a big one, so that I could put all my stuff in there. And if I'm walking down cobblestone streets, I can just have the backpack and blah, blah, blah. So that was for a European trip. They had the same backpack with wheels on it, and I did not get the wheels. And I'm just like, what was I thinking?
Yeah.
And it's just, these technologies exist and you don't implement it, and you just want to just kick yourself.
That's it. And I always talk about, I was like, okay, you have a suitcase, the same backpack.
Yeah.
Well, let's say suitcase, because
Yeah,
backpacks are a little different story. Same suitcase without wheels, then with wheels.
Yeah.
Okay. Do you pack the same?
Yeah.
Yeah. Do you need extra space for the wheels?
You know,
No.
frankly, you don't pack the same, because if you're carrying it without the wheels, that's going to be too heavy.
Yeah. Well,
right?
there you go. So other than being more limiting, right?
Yeah.
Do you go to the same destination the same way?
Yeah.
Absolutely everything is the same. It's just the wheels make everything easier.
Yeah.
However, it took till the 80s for young Bryan to be able to see a suitcase with wheels. And then what happened? Then we went for probably another, at least 20 years until I saw a suitcase with 4 wheels instead of 2. And now I look at some things just make sense.
Yeah.
Don't buy a suitcase without wheels in the year 2024. And they still make them, I'm sure, but nobody's buying them.
Yeah.
Right. Dave, as always, it's great having you on the podcast. So where can people go more to find more about Aptrix? And so if they're interested in cloud-based imaging.
So Aptrix is part of Planet DDS, which is Denticon as well, and Cloud9. So you go to planetdds.com.
PlanetDDS.com.
Yep.
Thanks, Dave.
Thanks, Brian.
And look forward to seeing you right here next week on the Patient First Podcast.
Thank you.